You're watching CTOM TV. Knowledge is power. Roanna's wondering, how many cancers are caused by inherited cancer genes? Is it common? She says she's got lots of cancer in her family, so I guess she wants to know how likely is it?
Well, if you look at a lot of the reports, they'll report.
What kind of reports?
Well, studies and so on. They typically say, 5-10% of cancers have a genetic basis. I would say that all cancers have a genetic basis.
You mean like some degree of inheritance?
Some degree of
basis,
inheritance, yeah.
Okay.
Yeah.
So that's quite a disparity, 5 to 10% versus almost all.
Now, I would say that in about probably 80%, typically we use 120, 150 gene panel to look at inherited genetic mutations. And I would say in a good 80% of those cases, we always find inherited genetic mutations.
That's
true.
That's
a small panel. So if you look for more genes, you're probably going to find that number goes up significantly.
Let's just clarify what you've just said there to Roanna and others who are interested in this concept of is cancer inherited? Do I need to be concerned? Right now, if you look at the American Society of Clinical Oncologists or some of them current studies on inherited mutations for cancer versus somatic or those that develop over the course of your lifetime, they're suggesting that 5 to 10% of cancers are inherited. But our clinical data over the last decade actually proves something else, which is that at least 80% of our patients, when we test them for inherited mutations, do have an inherited mutation that is influencing their cancer. And as Alex is saying, that's a 130 gene panel. There are lots of other genes. We're just not testing for them yet, right?
Exactly.
The panels
or we're ignoring them.
Well, the panels aren't quite there yet. So yes, if we're finding 80% of our patients have these inherited mutations based on 130 gene panel, and when we're going to be able in the next few years to have panels that allow us to look for a few hundred, that number will almost certainly go up.
Yes, exactly.
So very likely, yes, it's very common. And so what should Roanna do?
Well, briefly, I just want to interject there.
Okay.
You mentioned the ASCO, American Association of Clinical Oncologists.
Yes.
I think they're pretty on board with the
higher number?
The higher numbers and the need for genetic testing in all cancer patients. So I think most people who work within the ASCO organization would advocate for genetic testing for everyone.
Okay, thanks for that clarification. Yeah. So they should be pretty up on it.
As of now, as of these days.
Okay, great.
Yeah, so definitely get genetic testing, Ron.
Yes, inherited mutation testing, you can reach out to us directly.
We can help you with that.
Yeah, absolutely. We'll tell you what tests we would recommend, and then if you'd like our assistance, we can help coordinate that for you. Thank you for watching CTOM TV. Subscribe below and stay informed.